Wait for me.
Mr. Carter. Now, correct me if I'm wrong, you were a patient of Dr. Denise for the last several years, were you not?
Dr. Denise was my guy. Like,
She was cool.
my doctor, not my guy, because she's a woman.
That's
Yeah, sorry. For like 6-7 years or something.
Mhm,
I'm kind of really upset that she's retired. But like, look, not that you're going to be bad or anything. But
I didn't. What? Excuse me. I didn't think. I didn't think that was going to be bad.
yeah, but she was.
Listen, no offense taken. Okay, it's fine. You're in safe hands. Dr. D's in the house. I got you covered. I've never done anything bad before. Have I? So I've looked at your charge. Your teeth seem pretty good, lad. So I think this will be done in a jiffy. Okay. Yeah.
Just put these glasses on, Carter. And lie back.
Nurse Raspberry, beg that for me, please. Thank you. And
Rose,
quick
how
a little, the mirror, please.
Don't getting any ideas.
Yeah, get a ring, guys.
Got me an idea right now.
So, actually, can I please have a mirror? Thank you, Dr. Wolf. Thank you, Nurse Rose. Okay, let's have a little look. Let's get cracking.
Okay.
I'm not going to crack anything, by the way. Okay. Let's have a look. Oh. Oh. Oh, God. Oh. Okay.
Oh.
Sorry, 1 second.
Oh.
Oh, my God. What the hell is that normal? Okay, I've seen enough. I'm just winding you up, sir. I have seen a few little minor incidents, little minor thing.
I mean, minor. That
The minor
sound like
issues.
minor, bro. That sounded like you found the Black Plague in my mouth, cousin.
But no, listen, look, I'm not trying to freak you out, but I wouldn't be doing my duty as a dentist, as your dentist, if I didn't tell you the whole truth, enough about the truth. Yeah. Okay. All right. No, listen.
Okay, so what are you saying?
Okay, you have a couple of major cavities, and we're going to have to sort this out ASAP.
Cavities?
Mhm.
How? No. What? How many cavities are we talking about?
At least 10.
10!
10.
10!
10.
10!
10.
10!
10.
10! 10! How? I brush my teeth 3 times a day. I don't get how this could happen. I mean, I just saw Dr. Denise like 6 months ago. She told me my teeth were fine.
You know, Dr. Denise is 85. So, you know, she's getting a little bit old. Her eyesight's not that great. Her cognitive reasonings. Plus, she's a... You know what I'm talking about?
10 cavities. I mean, Nurse Rose, come on, surely.
Well,
Are my
I
teeth
mean,
that bad?
well, I'm sure that Dr. D's diagnosis is just for preventative.
Preventative,
measures,
yeah,
right?
because you get it even
And
cavitier.
that's not such a bad thing, Carter.
Look, listen, what I'm going to do is I'm going to send you a treatment plan. You don't have to do anything right now. Take your time, have a look, go through everything, check what your finances are. Don't make any rash decisions, but your teeth could fall out if you don't take care of them, buddy. So, you know, it's going to be fine. All right. Just take your time. All right. Safe blood.
No.
No. Okay.
Fine. Might try to say, that's...
Carter, so lovely to see you again. So tell me, how have you been? How's that lovely girlfriend of yours doing at Carter, is everything okay?
No. Miss Dr. Denise.
Oh, that is so very sweet of her. You know, I do miss her too, you know, but you'll be very happy to know that she's having a lovely retirement with all of her cats and dogs and budgies and all those things.
No. Jill, I don't... Look, this Dr. Dentorama you just told me that my teeth were mashed up, bro.
Oh, sorry, whatever do you mean? Carter, you are one of my best patients, and I know you take your dental hygiene very, very seriously.
Exactly.
Okay, Carter, start from the very beginning. What exactly did Dr. Dentorama say is wrong with your teeth?
My man told me that I have like 10 cavities inside.
10! No, that is quite an alarming diagnosis.
Look, so I just don't understand how this could have happened.
Wait, actually, Carter, I have some very good news for you. It just so happens that I have now just completed my training to become a therapist.
Therapy?
Yeah.
Well, congrats.
Thank you.
I mean, I don't know how that will help. I mean, maybe it would be good to talk about it. So Dr. Dentorama has this mustache, like
no,
my
no, no, no,
PE
no,
teacher
no,
did,
no,
and it
no,
was a
no,
bit
no,
weird still.
no,
So
no, no, I'm so sorry. Please stop. No, what I'm trying to say is that I'm now qualified to do some routine dental treatments as a dental therapist. Minor treatments such as cavity fillings.
okay, then sure.
Yes, what I can do for you today is have a really good look at the state of your teeth, whilst also giving them a very thorough clean. And afterward, I'll tell you my totally honest opinion on how many cavities I find. Now, how does that sound to you, Carter?
Okay, okay. I trust you, Jill. I trust you way more than that Dr. Banana Rama, the digger, the ling dong.
Oh, great, now let's get started.
Okay.
All done. There we have it. Have a quick rinse, and then we
Okay.
shall have a bit of a chat.
Hey. So, give it to me straight, Jill. How bad is it?
Right, so you do have a few minor cavities. Yes, but not 10. Definitely not 10. To be completely honest, I've absolutely no idea where that Dr. Dentorama pulled that number from. It really is quite baffling.
I knew it. I knew it. You
Yes.
wonderful human teeth polisher person.
Yes,
Thank you.
yes, of course. Now please do sit back down.
I will.
I do have some great news for you. I do have a free afternoon, so I could technically fill those cavities for you today.
Man, like Jill. Come on, cousin. You get me? Sorry,
No,
sorry.
no,
Again,
no, no, no,
sit
no,
down.
no,
Sorry,
no, no. There
that
is
was weird.
one
Sorry.
last hurdle. I will need to talk to Dr. Dentorama for permission to proceed.
I mean, do you think you'll go for it? I mean, I won't lie, Jill. I just don't want that Dr. Dudulada guy anywhere near my teeth. I don't.
Right. Well, the patient should always come first in my book, so just wait here, and I'll go and inquire at the reception desk now.
Okay. Thank you, Jill. Thanks a lot.
Of course. Right here.
And I literally don't.
I'm ridiculous. Roz. Roz, hi. Hi, Roz.
Timing. Just Carter. Is he still here?
Yes, he's still in my room,
Lovely.
actually.
Well, I was wondering, could you give him, please? It's just that my back is hurting. I really appreciate it. Thank you.
Yeah, yes.
I don't appreciate it. You
Actually,
can't.
Roz, about that treatment plan, I just,
What about it?
actually, do you know where Dr. Dentorama is? Rightio, Lisa. Thank you so much for that. Actually, Lisa, are there any nurses available to assist me this afternoon?
What? What? Ew. Regine is speaking of that.
A nurse? Oh, Jill. Oh, bless your wee heart. You still trying to find a nurse, are you?
Well, I...
You want someone to help you hold the floss? Right, guys? No? Okay, fine.
Well, yes, actually, I do. Hygienists and therapists need nurses too. I would work far faster and more efficiently with the help of a nurse. It's not rocket science, for God's sake.
You know.
About what does a therapist even do then? Do you just do a deeper teeth clean or wait, you use fancier dentist tools?
Yeah,
I get it.
it's back for
I got
Her
it.
tools are made of 28-karat gold.
No, Lisa. A therapist can do minor dental treatments, which is why I will be needing a nurse if I am to help my
Excellent.
patient Carter this afternoon.
Excuse me? Sorry. What did you say? You mean my patient, Carter?
Yes. I was just about to come and talk to you. Well. Yes. I was just about to come and talk to you. You see, Carter has been a patient of mine for over six. Can I have your attention, please?
Of course you can.
6 years. And we have a lovely relationship, and he is more than happy for me to proceed with his further treatments this afternoon. And as I am a newly qualified therapist, I am more than capable of taking on a couple of cavities and filling them this afternoon, in fact. I'm actually really good at filling cavities, if I
Right.
do say so myself. I actually graduated top of my class.
I just like
Oh
makes
my
sense.
gosh, what a clubs.
You hear that, Mr. D? She's really good at filling those cavities in,
Hey,
mate.
I don't care if you're good at filling some cavities now, Jill. Carter's my patient, so if anybody's filling his cavities, I'm filling his cavities.
I just know that you are such a busy man,
Busy.
Dr. Dentorama, and I just figured that since I have a free afternoon, I would help you with your heavy workload. I'd only proceed with your permission, of course.
No, I'm not.
Oh my God,
And
I know. I'll be your nurse, Jill.
Oh, hell
Oh,
no.
you know.
Absolutely not. Absolutely not. No, you're not taking my patient. You're not taking my nurse. This is not happening. It's just not happening. I'm sorry.
I just...
Oh, hi there. I'm so sorry about that. What was your name again?
Christine,
Oh, yes.
I'm here to see Dr. Antoinette Drillshard?
Yeah, that's
Her,
the one.
Yeah.
Okay. All right. Well, if you just want to take a seat over in the waiting room, she'll just be out with you in a second. Yeah. Okay.
Hi, Dr. D.
Thank
Hey.
you.
Okay, just to clarify, you do not give me permission to proceed with my patient Carter this afternoon with his further treatments, even with the lovely help from Ross here?
I was only joking. I've been really busy this afternoon. And Dr. D, we have a patient in 5 minutes, so hurry up. I, for one, plan on leaving on time today.
Look, Jill, I'm sorry. I can't give you my patient, and I can't give you... You don't even have a nurse. Just sort it out, all right? Sorry.
Dr. D!
Oh, Jill, before you go, look what I have got for you. I'm like, what is still thinking? It most certainly is. Are you sick and tired of those old traditional cleaning techniques? You know the ones I mean, the ones that leave you hunched over your patients for hours on end. Why do it to yourself? Why do it to your patients when you could upgrade to the reliable, like dental cleaning system that is called the Enterflow Prophylaxis. No, yeah. The powerful device leads the 8-step GPT protocol with 4 decades of research, technical prowess, and consumer satisfaction. Isn't that right? Yes, that's right. Airflow Max uses air, water, and erythritol powder spray to remove all of the biofilm and stains from your teeth and tissue, which we can see using our organic dye. What? Using this device, you can remove up to 100% of harmful bacteria from your patients, reducing the chances of decay, infection, and disease. At the same time, providing the perfect platform for your fellow dentists to discuss additional treatments such as cosmetic or whitening. And all this without any scraping, drilling, or, best of all, trauma to your teeth or gums. Oh my God! So, how does it feel to lose your GBT cherry?
Oh my God, it was amazing. I've got to be honest though, I didn't really like you lot scraping around in my mouth, but this time I actually didn't feel a thing. And that little warm water jet thing was a really nice touch.
Well, there you have it. Another satisfied GBT customer. Let your patients enjoy oral wellness today. And remember, make your practice a GBT certified practice. You can purchase your Airflow from any certified online provider, and there is even a representative, I believe, somewhere in the audience tonight. Arena, are you here? Woo-hoo! Over there, she's your go. But for now, thank you and good night.
No.
Hey, Lisa, was that my client that just went there, my patient, one I had the root canal with, like 2 weeks ago?
Yeah.
I just saw her, right?
Yeah, I think so. Why?
Well, first off, why is she not booked in with me? And why have I not seen any more scheduled appointments with her? What's going on?
Because she's booked her scheduled appointments with Dr. Antoinette, not you.
Sorry, what? So she's doing the crowns now?
Yeah, that's right.
Having me. Dr. Antoinette, could I just grab you before we do the stock cupboard inventory? I really need to talk to you about Jill, and we're getting her this nurse. She's been banging on about it for ages, and I'm running out of excuses, so some direction. Well, what's your excuse for there being no Wi-Fi or phone signal in the practice hall? Seriously, I swear I asked you weeks ago to sort this out. You did, actually. Yes, I am still waiting for you to sign off on the PO. Silly me. Actually, you know what I'm like, Hannah. You just need to work harder at trying to get my attention. If it's working. Sure. I was really needing money like that.
Oh my God, you're never.
Oh, you guys going for lunch?
Oh, wait, I'll tell.
Oh, that's cool. That's fine. Be all right. It's tough to have lunch by myself. It's just me and you, phone. I'll be your friend. Sick.
All right. If you're taking your kids to the dentist, you. I love this tune. The dentist isn't your favorite place, and I know you don't want to go. Me and my nurse sitting here, we're wondering how you hate us so. We talk for hours and hours about preventing gum disease and tooth decay, but you don't listen to me. You keep on eating sweets and smoking. Hey, Dr. D, what's going on, brother?
Oh my God, it's really you. This is really you. I'm not tripping balls, am I? This is really you.
It's kind
What
of
are
me,
you doing
yeah.
here?
I work here, bro.
Stop.
Yeah, man.
At the Frosty Lady?
Yeah, bro. Right there. But you know what? I see you looking all down and depressed and glum. Proper Billy No Mates. What's been going on, bro?
Yeah, man. Look, listen, dude, I've had a really tough year. You've no idea.
Actually, bro, I have a big idea because it was all over social media. We all saw it, and that's kind of my domain. And you went viral, but not for good reasons, bro.
Not good reasons. Listen,
No.
can I ask you a question?
Sure.
Can I get some advice? Can I call you
Absolutely.
SD, by the way?
Yeah, bro. Of course.
Awesome, sick, bro. No, sorry.
Don't do that again.
Look, how do you do this? Like, you're very popular. Everyone loves you. Like, you know, you're successful. Everyone gets along with you in the office. Like, how do I get people to respect me? Like, Roz, my nurse, she shits on me all the time. She undermines me. She contradicts me in front of clients, in front of patients, in front of staff members. Like, I feel like I'm just a nobody there.
That's pretty shit, to be fair. I can't
Yeah.
lie, yeah.
And then Jill, the therapist, hygienist, whatever she calls herself now, like, she wants to take one of my patients. Like, the temerity, the cheek of that. And then Dr. Antoinette drills hard, where her name come from. You know, she's taking on my clients, and I think it's a conspiracy to get back at me for something that I did last year. Do you know what I think she's doing? She's for to get another award.
And how many awards have you got?
I've got,
Okay.
yeah, I
then.
got no awards.
Yeah, so how do you expect your team to take you serious if you're not putting in the effort? If you're not going to level up, you're not going to improve your skill set, go out, do some courses, bruv. Because if you're not bringing some value to the team, then how are you going to ask for that higher commission?
Do you know, I didn't think about that at all. Can I ask you a question, by the way?
Sure.
And I don't want to be rude. Like,
Go for
just,
it.
you know, we're all friends here.
We're friends, bruv.
How much do you make on commission? I know, is it? Loaded.
Brother,
Yeah?
I don't get out of bed for less than 85%. Come on. Making it rain.
Shut the cheddar front door.
Champagne.
All right, so how do I get more commission? How do I ask for more?
Nah, see, you don't ask for more commission. What you got to do is ask yourself, what are you bringing to the table? What are you bringing to the team?
What am I bringing to the table?
And if you're bringing a big bowl of jack shit,
It's a pretty big bowl.
There's a big bowl.
Big bowl.
Smells.
Massive check.
So how are you going to get that extra commission if you're not bringing nothing to the table? Tell me something. What's your like social media following like?
I got less than Jesus.
Okay. And do you post anything on socials? Like, do you put cases up there or patient journeys or do you make content?
No, but I was cancelled once by an influencer. Does that count? This ain't like all publicity is good publicity, right? Right?
No, bro.
Oh.
Not with what we do.
Okay.
Yeah. All right, okay. What about like hobbies? What about extracurricular activities? Can you sing? Actually, don't sing. That's kind of my job. But can you dance?
I tell you what, I can do a good impression. I do a good Donald Trump. We're gonna make teeth white again.
That was worth a round of applause. Come on. Okay. Okay. What else? What else you got for me?
Well, as a dentist, obviously I can floss. You know, this is it, right? This is it, right? That's flossing, isn't it? No? Oh, sorry.
Bro.
Yeah.
You see that?
Yeah, I saw that.
Don't
I heard
ever,
that.
don't ever do that again.
Don't do it again,
No,
right?
don't. Especially around me.
Yeah.
Because these people like me.
They got rid of
You not so much.
No,
so
okay.
don't do that again.
Yeah, yeah. What do I do, man?
I'll tell you what. Why don't I show you what I do? And then maybe that'll give you some inspiration.
Yeah? All right. Oh. Whoa. Shoot.
Now this is a story all about how your dental career got flipped upside down, and I'd like to take a minute, just sit right there. I'll tell you all about Dr. D's crappy year.
Yeah, whoa.
All right. Yeah. In Flossie Lady Clinic, you work every day making dumb decisions and silly mistakes. But here at Dentorama, we will help you, my guy. Stop moping around the practice and hold your head high. Do aesthetic dentistry, but do it right. Make your patient's teeth all sparkly white. Because you get one little problem and it's a nightmare on Wimpole Street. We know who lives there. But you're a cool dentist, you're a stand-up guy. So stop doing shit that makes your patients cry. Instead, treat them well and keep them happy. And soon they be yelling, go see Dr. D. And be nice to your peers and colleagues, bruv. We all want to see you win. It's all love. So stay positive and you will get there. Dr. D, Dentist of the Year.
Oh, man. Yeah. Yeah. Whoa. Well, I've learned my lesson. I won't do it again. No more feasting patients for financial gain. So let me take a minute, just sit right there. I'll tell you all about how I became the dentist that cares. Where's he going? I'm going. Hey, hon.
Where's my invite to the party?
Dude, yeah, party's always there with
Who?
my lad.
What?
Singing dentist, he was right here.
What?
Like literally, we were rapping, we did a song together. He was giving me advice. He was literally standing right here.
Yeah, and Johnny Depp. Are you all right? I
No.
think your sugar levels might be dangerously low.
Maybe I'm losing my shit.
Are you all right, though, Dr. D? You seem a bit...
Depleted, depressed, undervalued.
Yeah, I heard about what happened with Jill.
Yeah. Like, it's not fair. Like, okay, so Jill wants to take my patients, and then Antoinette, she's like, taking the patient. What am I supposed to do?
Are you talking about Christine from
Yeah.
this morning? Yeah, well, we can't do anything about that. She specifically requested Dr. Antoinette. Yeah, she read about her in some fancy magazine and about how amazing
All
she is.
right, fine. She want to see me. It's fine.
No. You know, we can't do anything when a patient specifically requests a dentist.
I know. It's just not fair. She's got loads of patients. Like, can't she throw us a bone once in a while? Wow, what's so funny about that?
I just think it's a bit ironic that you're annoyed at Dr. Antoinette for not giving you some of her patients, but you won't let poor Jill perform a few basic fillings on your shared patient, Carter.
Yeah. I'm a shitty person.
Yeah? No. No, but you are worse when you haven't had lunch, so I did get you something.
Thank you. Oh,
Check-
you're the
check it.
best.
Yeah. Well, consider it a peace offering.
Why? What's happening?
I need you to work this weekend.
No.
Yeah, actually,
no,
all
no.
weekend.
No, I've got plans.
Yeah. No, you are a star. Thank you so much.
Thank
I'm
you.
so
Yeah,
grateful.
cheers.
Good chat.
Thank
Have
you.
a good
I have
one.
plans.
Yeah.
I have so many plans.
I have no plans. Wow. Well, there we are. That's great, isn't it? If only I had a room full of dental practitioners, management people that could help me out in this room here tonight. Maybe. Maybe they might be here in this. Oh my God, there you are. You beautiful people. Before we go, I had to bring my actors down real quick. Where's my actors? Come on down here.
Dental practitioner. That's in a bar.
We're going to go to the bar. But before that,
May's going to come and say a few words. But before that, we're going to take a little bout. Ready, guys?
well,
Yeah.
I want to bring our group actor. I want to bring our
Hello,
group
SD.
actor. Yeah. Woo! Thank you, guys.
Are you sure? Unless you want to say something. No, thanks for coming. It took me 30 seconds to convince him. Like, yeah, but you know what? No, yeah, I mean, but no, yeah. And great. Actually, the team were so impressed about how you actually had everything learned and you got along with everything. So yeah,
Thank you so much for that.
how do I help? And you were just in Australia, came back. You know, I thought, okay, this is not gonna happen. Like, and you still delivered. So we're very grateful. Thank you so much. Wow. Okay. Maybe we got in trouble with all this talks, but it's great. You like it? Yeah. So we have. We're gonna bring again the panelists. In the meantime, is there any hygienist or therapist that wants to say something? No, apart from killing me? Apart from killing me? Wait a second, one second.
I'm Alice. I'm a hygienist. That was so triggering to watch. That poor girl just wants to do a couple of fillings just for her bone. Just help her out. She's qualified. Just like, you need support when you're newly qualified, otherwise
Yeah.
you're not going to get the opportunity.
Yeah.
And we're quite happy to say, oh, I think you need to check up. I think you need this. I think you need that. Off you go. Just pass it back a little bit.
Yeah.
Like, and if you don't like something your therapist or hygienist is doing, just have a conversation.
Yeah.
Like, they just want a little seat at the table.
Good. Power. And this is why we wanted to well, please back George, Andre, Faye, need your opinions. But yeah, this is why we wanted to bring it, because this is how this happens in clinics, and this is why we wanted to put it out here so people could see with their eyes and trigger. And this is why we're here. Faye, hi. You were saying before, oh my God, I wanted to say so many things about this. Okay, I want to start with this. Do you want to say anything?
Well, I think the dental therapists in the room will never speak to me again if I don't take this opportunity. I don't know what. Did you just say this, Alice? Oh, okay. Alice has covered it. It's all right. Alice has covered it.
Yeah.
Yeah, I think I like to think that I'm not sure that is indicative of practice today. I like to think that therapists are, we've moved on a little bit with the, direct access, and therapists do a lot more than basic fillings. They do the same fillings as dentists do. Guess what? It's the same. They're not basic. They're not minor, they're not small, they're exactly the same. So, yes, I had to open with that.
Are exactly the same if you give them the opportunity to actually do them, no? And become good. And I for us, the collective of hygienists and therapists, they came to us and raised those concerns, and we asked them, okay, what are the main issues that you're facing? And Miranda from the British Society of Dental Hygienists and Therapists, she was very kind on sharing, okay, those are the issues that we're facing. We put everything to an extreme, obviously, but this is what we want to do, and then we want to trigger these things when tomorrow you have a hygienist, a therapist, and they're asking you for opportunities to do their job, having consideration all of this, right? And something that I love, and I had a conversation with Kat, and I admire your work. I think you're a therapist and you do a brilliant job, and I think you found the space. And you were saying like how Sarika gave you a space for practice, the dentistry that you wanted. I wouldn't say what's the secret, but what would you say to other clinic owners, Sarika, in terms of like, maybe I need a microphone here, how can they embrace this? Yeah.
I think you just have to have that mindset and kind of be a forward-thinking clinician or a practice principal to involve everyone in the dental practice and allow them to work within their full scope of practice. I think as a practice principal, I've always been pro having a dental therapist. And because it improves my workflow, it makes sense from a business perspective for me to refer those restorations to my dental therapist so I can create the time to do what I love to do. So there's that aspect of it. But it's also that working in a multidisciplinary practice has so many benefits. By involving everyone in the team, everyone gets to do what they love to do, and patients are getting the best for what they need from every clinician in the practice as well. So I think what we've created with Kat and I is something really special. And I think more practice principals have to be open to working with dental therapists, trusting them, having that open communication. And dental therapists really have to have the confidence to ask for that work, to take photographs, to build their portfolio, and to stay hungry. Not just give up, but keep going back to associates and principals and asking for more referrals. You've got to build your book. So there's that aspect, I think, that doesn't always happen. So don't give up. I think just work, and there is opportunity for collaboration. That's what I'd say.
Great. Thank you. Kat, yes, of course, please.
Well, obviously, thank you so much, Sarika. Not just for that, but also the amazing job that I have, because it's awesome. But there is another side to it, and it's not just that. I've gone into practice and I've found the most amazing practice owner who's super, forward thinking and is really proactive about growth. But I also feel that I've had to spend a number of years being proactive myself and saying, no, this is how I will grow your practice. This is how I'm going to grow your diaries. And I'll go to my associate dentist that I work with and say, what can I do to improve your working day? What can I be putting in your diary to make sure that you're reaching self-actualization, reaching the point of being able to do treatments that you absolutely love to do and that you're really good at, to make my patients happy, to make your patients happy, but equally to mean that I can do that as well. And I think confidence is the most important thing, and communication. And if you come with confidence and you use great communication tools, obviously I'm really into my digital, and that's because it supports communication.
Mm-hmm.
But that confidence has to come in two ways. I couldn't have that if I didn't have a mentor.
Yeah.
And there's a number of my mentors are in the room right now, but I couldn't have confidence if I didn't have people around me who said, you done it right there, you didn't do it right there, try this the next time.
Thank you, Kat. So basically we're same with associates, same with, we actually saw the situation mirroring from the associate to the principal, complaining of, why is she taking the most complicated cases, and then he was doing the same with a therapist, and this is happening, right? So George, how, I don't know if to ask you this question, but I would ask you, does hygienists need nurses?
You've got a lot of questions tonight. Does a hygienist or therapist need a nurse?
Yeah.
It depends what they want. I mean, I think if they're doing for some procedures, if they want one, and I've got some hygienist therapists that don't want to have a nurse because that's just, they feel that maybe it's getting in the way of communicating with a patient, and that's just their vibe. That's what they want. So it's up to, when you're going around your hiring process, hiring a hygienist or therapist, you might have a role where you can't afford to have a nurse, or you can afford to have a nurse. So it's being upfront in what that role is and if it's going to suit them. I do think, personally, if I was doing that role, I couldn't work without a nurse. But some can, if you're going to be doing procedures, doing like fillings and stuff like that. Yeah, you're gonna need a nurse. I think that if you're going to introduce therapy into your practice, it's not just about having the idea of introducing it, but it's also, in this situation here, there was a lack of clear messaging from management to the staff members, and it wasn't tailored for them. There was no messaging to reception saying, this is what's coming now. There's no reception to the dentist, this is what's coming now. And just a lack of supportive nature from everyone.
Yeah, no, I agree. When you said no, I heard a lot of. Faye, what do you say?
I mean, let's
But
not...
wait, sorry, but what yours thinks? I would say, like, I don't know if there is a percentage of how many nurses work with, hygienists work with together with a nurse.
Yeah, interestingly, inside the M25, less so than outside of it. Certainly in Yorkshire, where I am, you struggled to fill a post if it was advertised without a nurse. Let's just not forget, perhaps there are some people in the room that don't realise that it is the law now. So it is a GDC standard now, except for exceptional circumstances, whatever they are.
Wait, can you repeat this? So
16 points. Someone help me out. There you go. 1.2. So yeah, those that aren't providing that, need to be ready to justify that. So that's the kind of first thing to note. But perhaps more importantly is that there's a patient at the centre of this. So I think it's not always about personal preferences, although I think you're right, George. Certainly there are hygienists of my generation that just can't be doing with it because they're in my way. And but what you've got to look at is there was a patient at the centre of all of that, and you have to question, the scope and what we've got to get into those appointments nowadays. Is that patient going to be treated to the standard they need to be treated to and should be treated to and deserve to be treated to? If you're trying to do your own charts, or what are you not doing? Are you not collecting data? Are you, I appreciate the actual holding of the aspirator whilst you've got a tool. Perhaps some people prefer that, but it's kind of everything else that fills that appointment, right?
No,
so
I agree. You've
got to question, what standard is that patient being treated to if you're eliminating what is considered to be important?
I feel like all the clinic owners, they're going to hate me today. But Laura, you wanted to say something?
Hi. I just want to touch on what Faye said.
So you are...
I'm Laura. I'm a dental therapist.
Just a big round of applause to all hygienists and hygienists.
That's okay. This was very important for us, and
Cool. So as Faye was saying, a lot of hygienists, what do nurses do? They hold the suction. They might chart some things. How many people around the room realise that we haven't touched the surface on periodontal disease in the last 30 years? It's been a flat line. None of you sat there today has made any impact on perio. And that's really disheartening. It's because we're just scan polish machines. We don't have the time to do the charting. We don't have the time to do the perio discussions that we need to, and we need the nurses. It's not about us, it's about the patient, and we need to do better, basically.
Right.
Yeah.
I have was Rebecca? Yeah, Rebecca wanted to say something.
Thank you. So my name's Rebecca and I'm a dental nurse. And I'm going to kind of touch on what George said and what Kat has said. And I worked with Kat for a number of years. And in the practice we worked at, there was an ethos that as a dental nurse, I was too expensive to work with her. And what happens is, as a practice, if you start alienating clinicians and alienating members of staff, that's going to trickle down through all the support staff, or the admin staff, or the dental nurses. So when the situation arises where a clinician's reasonably asking for an assistant, a chaperone, everything that a dental nurse is, everyone's going to berate them because practices have said, no, like you're too expensive. They don't deserve you. And that's what I think we have to be really careful of as well in this industry is, as a dental nurse, seeing that divide between clinicians. To me, a clinician's a clinician. I get paid the same hourly rate, whether I'm working with a dentist, a dental therapist, a dental hygienist, even a specialist. I get the same money. I'm in the building. And I think practices have to be very careful about creating divisions where divisions don't need to be made. And a lot of people, it only takes one or two comments for somebody to have an opinion. And then suddenly that opinion is, well, that's truth, that's gospel. I got paid the same amount of money working with Kat or not working with Kat, but to be told by my practice manager at that time, you're too expensive to work with her, is so disrespectful to her as a clinician. And I think as a team, we need to look to whether they decide they want to work on their own or not. Dental therapists, dental hygienists are clinicians, and I am there to support the clinician as well as having my own scope, but that's another story for another day. But we are there to support the clinicians, and it shouldn't be a case of there's a division of what type of clinician you are. So whether you can afford it, whether they want one on their own, we need to be very careful about creating these divisions and then enforcing them, especially for newer members of staff coming in. Thank you.
Thank you, Rebecca. Anyone want to respond? Good. Great. Created us some debate here. It's we all on the same side. It's not about who deserves or not deserve, but we're just raising the concerns. And I'm glad to say that probably this is the only room in the industry where all the different sectors are together and debate, because normally I go to a conference where there are only cosmetic dentists. We talk about our problems, but the rest of the collective doesn't know. Nurses do the same, therapists do the same, and then so for us it was important that we know how we all feel, which we can kind of do, but it's for us was important that this conversation was happening. We have another. I don't know if this is for me to shut up or actually. Okay.
Hello, my name is Brittany. I'm a nurse. I'm not just a nurse. That's my Instagram. Please look it up.
Which one? Sorry, say it again. What?
Not just a dental nurse.
Not just a dental nurse.
None of us are. We're all on the panel.
This is your Instagram?
BADM, yeah.
Okay.
All of us working collaboratively will increase the productivity for your practice. That will increase your revenue. And that is from a fantastic nurse, fantastic therapist, fantastic dentist, fantastic receptionist. All of us working together will benefit a practice. And there's no just in anyone's title. There's no just a receptionist, just a nurse, just a therapist, orthotherapist. That there isn't room for. So yeah, I just want to say that we all work together to make a great practice, and without each other, there isn't a great practice.
Right. And this is what we wanted to bring and discuss today, right? We were talking about the worst dental team ever, which maybe was and these are the conclusions that we wanted to get. There is, we can't do anything by ourselves. And I always say my treatments, they have in my treatments there are more than 20 people involved in every treatment, from the person that does the marketing to the reception to the nurse, the nurse that goes into the second day, whoever is in the hygiene decon room. It's a huge team, and if one of them fails, then it doesn't happen. So thank you for bringing this up, and I completely agree. It's like you're nothing with the rest of the team, and the rest of the team is nothing with the others. So thank. Yeah.
So I probably agree as well. My name's Mo. I'm a dentist, but I think there isn't anyone in the room who hasn't either been in their foundation year or just started as a nurse or just started as a therapist or a hygienist who hasn't spent some time to develop themselves. No practice will kind of volunteer an individual and say, yes, please go and spend X amount of money and X amount of time, invest yourself, and then we'll, of course, give you all of this work. But there is real value that any individual who does that brings to practice. And it's a shame that it doesn't feel like that's quite been recognized yet for nurses and therapists. But it does feel like it's coming. And practices that are recognizing that are seeing not only the financial value of it, but as a lot of our colleagues seem to be pointing out, there is a real ethos in a team that seems to come forward. And those are the practices that seem to keep.
Yeah.
It would be nice to see more of it, but it does seem like it's headed in the right direction.
So you want to see more self-development. I want you to give this opinion because I know that you're strong in this. But you want to see every individual in the clinic.
I think there's room for it. And
There's room for it. I completely agree. I think everyone.
Arguing for whether or not it's financially viable or not, I think cosmetic dentistry doesn't exist, because we'd still be doing amalgams, we'd still be pulling teeth out, we'd still be putting very destructive crowns on teeth, if not for a select number of people saying, no, I will take that step. I do believe that this is a good idea.
Yeah.
But that investment requires that principal dentists are willing to kind of accept that that's a peer-reviewed way forward.
Yeah, I agree. Thank you so much. Andrew, what do you think about this self-development of individuals? And actually, we always talk about, dentists doing communication courses, practice manager, this, that. It can be everyone in the clinic, right? Maybe this is something that should be standardized.
Yeah, I think that in terms of professional development, you have to have, in my practice, both dentists, nurses, and everybody, I financially support them to do courses.
Wow.
Whether technically or emotional intelligence and stuff like that. So every 2 years, we do a communication course for the nurse. We close the practice. They stay there on the weekend. They get paid.
Can you repeat that?
Yeah, they get paid. You have to. Makes no sense. Yes.
We all moving to Portugal for a reason. Yeah.
I was thinking about that. Portugal, we don't make that much money, but we don't have so many issues as we have here. But yeah, I actually support them financially, both the dentists and nurses. So for the nurses, we do emotional intelligence courses, emotional intelligence and communication skills with patients. And yeah, we close the practice for a couple of days every 2 years to do that. I think that comes before team building and stuff like that.
Yeah, I completely agree.
It makes no sense to team building if you don't make sure that things are efficient in the practice.
No, I completely agree. I think it's so important. And at any other technique, right? Or any other software, machinery, whatever you bring into the clinic.
And one more thing, I think that we have to be in this for the long term. That's what I think. So you have to give if you want to get. That's it. As a leader in any practice, you have to give. Otherwise, you're just seeing the short term and it will not work. So this is like if you open a practice, it's like a 10, 20-year thing. So you will eventually gain the fruits of your investments in people sooner or later.
completely agree. Sorry, no, we can't hear you. Where's the microphone?
I was just saying that it's self-leadership skills that the team needs. It's to learn how to lead themselves first, have the autonomy to lead themselves and make decisions. And I think in that way, they can go out there and then really start to lead other people within the team as well. So it really begins with that, but it's a very good point.
I just wanted to add something because also I think one thing that stuck out is the expectation of the team for person brings the business in to like give them all of the work, which I was talking to George about earlier. I think it's actually really important that the principal backs their team. Like, I back my team more than I back myself. And I say, you know what? This is the best person in the practice to do your fillings. This is the best person. My hygiene therapist is amazing at doing this because the patient will believe you. And I think if you have an abundance mindset, you'll do much better. And I think
agree.
it's really important because the scarcity mindset I see so much in dentistry. They're afraid of people taking their patients. They see this dentist, will they prefer them? But if you think of an abundance mindset, I think it just works so much better. And I think that you need to believe in your team and your team. I think is really, as Sarita said, I want to echo, like, autonomy is so important. And we now have social media skills and tools available. Like, everybody is their own brand. And again, I think when the team recognizes that everyone can come together, you have a much more successful team.
Completely agree. Great. Okay, well, I think we are going to wrap up the night. Where am I? And I want to, maybe we start bringing, if they can, we bring everyone here. So I want to use these last 5 minutes because I think people are thirsty and hungry, and and you want to keep talking about this and enjoying the night. And for me, it's now the time to say thank you. And first, I wanted to say thank you to, if they are here, no, all the volunteers. Are they here already? No, we had volunteers. Oh, okay, so they can all come here, all the actors and volunteers. Where's Bruno? But I want to say, first of all, thank you, you three. You did amazing, and I hope I don't put you into much trouble, but actually, I love everything that you said. Thank you, Faye, for making it happen. Andrew, thank you for coming all the way from Portugal. George, you don't do many events and talk in public, so I'm very grateful for you coming. So please be with us out here. It's not easy. It's so difficult. They don't know the answers. They don't know the questions. They just come here. There's like, I don't care. We go with the flow. And I don't know if it's still there, but anyway. Wanted to say thank you to this time I wrote it down because I would forget people. I don't know if it's Bruno or I think we have people here, but one second. Guys, please come in there. Everyone just okay, big round of applause to the actor, please. Oh. Everyone in. All the volunteers, thank you so much. Thank you so much. Incredible. Milad, you're now a part of it. I'm sorry. You're part of it. Everyone here. Bruno. Oh, share. Actually, I forgot there is a box. There is a box there. Okay. I wanted to do a special thank you to someone that, I mean, we did this last year, but she is, she's been working so hard on putting this together. And just to let you know, all the actors, they have other jobs. And acting is one of the hardest professions I ever seen, because you don't know what you're going to do the day after, and it's a very badly paid job. So you do the best that you can. Oh, yeah. I don't actually, I'm sorry. Sham, you're going to kill me, but that's fine. So Sham from Tooth Angel was very kind to
We're very prepared.
we're very prepared. So Sham, thank you so much. Every actor will get one of these. So you brush your teeth. Yeah, very good. Thank you. There's a bad stuff. Alice, this one for you. If anyone wants also free stuff from Tooth Angel, just talk with Jam. All the volunteers. Oh, and also the bags. I sorry, and the hats and the this. Look, it's amazing. Bruno, come. Oh well, so I was saying, someone that works very hard on putting this together. You can't imagine the amount of work that she does. Actors, Ben last minute had to go to France to do a work in the middle in the middle of the rehearsals, came back, and please, I want to give a huge applause to Nicole. Pretty loud. Theater. She writes all the script and rewrites it, and then sends it to me, and then you don't listen to me anymore. You're like, no, it's like, I don't care. I'm gonna do it this way, and it's actually amazing. No, but honestly, it's incredible the amount of work that you do. So thank you so much. Thank you so much, Bruno. Bruno's always like, I take the most of the all the compliments and credibility, this kind of things. But to be honest, I don't do much. I don't know. But we wanted to say thank you to every single person that started this, from our Joe Lovett, which he co-founded this with us, to every single sound engineer, music engineer, they've been with us in the institution from day one. I don't know, in every event we have more than 50 people. In the more, this is the 6th event in 2 years. First one was like September 2022. Time flies. We had like more than 1,000 people coming. You see all the new people that came today. And I wanted to say also thank you to Byte Hype team, which they're recording. If you like any of the recordings that we do, they are the guys with Kian. Kian is our social media. So if you ever like our social media, I'm sorry you can't work with him because it's that. But Kian is incredible. Alice, thank you so much. Alice is a stage manager. So stage manager puts everything together to make it boom, 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 boom. Super hard work. And is it missing? No? To my wife, thank you for. She's like, I can't wait for this event to happen. She'll be driving me crazy. No. And to my little daughter, maybe next year we're gonna try to bring her in. Let's see how is their, what they're asking for. And now I want to say thank you to everyone here that came tonight. This means a lot to me. It means a lot to us. It's very, very hard to fill this room. All the sponsors that believe on this craziness. Like this is a lot, and these people that we work very close together with them to understand if they have the same values and they want to do a better industry, and they really do. And just to invest on this kind of events says a lot from them. And I think that's it. No. After party from our side, we are taking this can't share more, no? Can't say, no, you were supposed to say, no, you can't. I can't say more, but we are taking this to the next level. To do that, we are going to be silent for a bit, so you might not hear much, but we are basically regrouping. If you ever wanted to work with us or do something, this is the time, because we are doing a lot of cool things. So, if you ever wanted to be part of this, it's the time. And we are very excited for what is to come. And I'm not going to talk more. So now it's time to enjoy the drinks, to enjoy some food. At 11 o'clock, they're going to kick us out. Don't take it personal. They're going to kick us out. But good news is that we just walk 8 minutes to the next venue, which is at the B@1 Regent Street. It's just 8 minutes, and we keep doing there till 3 in the morning. Downstairs, and anything else I'm missing? No? Good. Thank you so much.
Thank you.